I want you to do something for me right now. Swallow just once and pay attention to the back of your throat. Does it feel like something is sitting there? A layer of mucus that never fully clears? A thick coating that comes back within minutes of you clearing your throat? Now think about this. You've probably been clearing your throat over and over again every single day. And if I asked you when it first started, you might not even be able to tell me. That's because it didn't happen overnight. At first, it was just in the morning. Then it started showing up in the afternoon, too. And now it's just something you live with. You keep water nearby at all times. You've stopped eating certain foods because they seem to make it worse. You've tried honey, you've tried lozenges, you've tried clearing your throat until it feels raw, and yet the mucus is still there. I want you to understand something important today. That constant mucus is not happening for no reason. It is not simply something that comes with getting older. Your body does not manufacture the same symptom day after day, year after year, without a cause behind it. Every persistent symptom is your body sending you a message. The question is whether you know how to read it. My name is Dr. Andrew Sullivan, and today we're going to talk about exactly why that mucus keeps coming back, what's actually happening inside your throat and sinuses, and what you can do about it starting tonight. Here's why this matters more than most people realize. Chronic throat mucus, the kind that lingers for weeks, months, sometimes years, is rarely a standalone problem. It's usually a symptom sitting on top of something else, and because it feels so minor compared to chest pain or dizziness, most people never bring it up with their doctor. They just assume it's allergies, or the weather, or simply part of getting older. But in my years treating patients over 60, I've seen this exact symptom trace back to at least 5 very different underlying causes, and each one needs a different approach. Treat the wrong one, and you'll be stuck clearing your throat for years with nothing ever changing. Let's start with the most common cause, and it surprises almost everyone I explain it to. It's called postnasal drip, and it happens when the glands in your nose and sinuses produce more mucus than usual. And that mucus drains backward down into your throat instead of out through your nose. Your body actually produces about 1.5 liters of mucus every day, even when you're completely healthy. Normally you swallow it without ever noticing, but when production increases or the mucus becomes thicker than normal, you suddenly become aware of it sitting in your throat. Allergies are one of the biggest drivers of this. Dust, pet dander, pollen, mold, even sensitivity to certain foods can all trigger your sinuses to go into overdrive. And here's what surprises people. Allergies don't always show up the way you'd expect. You might not sneeze constantly or have itchy eyes. Sometimes the only sign is that persistent throat mucus, especially first thing in the morning after you've been lying flat all night. But postnasal drip isn't the only explanation, and this next one is where things get more serious. It's called laryngopharyngeal reflux, or LPR for short. Think of it as the quieter cousin of heartburn. With regular acid reflux, stomach acid travels up into your esophagus and you feel that burning sensation in your chest. But with LPR, the acid travels even further, all the way up past your esophagus and into your throat and voice box. And here's the part that catches people off guard. Many people with LPR never experience heartburn at all. No burning, no chest discomfort, nothing that would make them think it's related to their stomach. Instead, what they feel is a constant sensation of mucus, a lump in the throat that won't go away, a need to clear their throat repeatedly, sometimes a hoarse voice in the morning that improves as the day goes on. The acid irritates the delicate tissue of your throat and your body responds the way it always does to irritation. It produces more mucus to try to protect and coat that tissue. After 60, this becomes more common because the muscle that's supposed to keep stomach contents where they belong, called the lower esophageal sphincter, naturally loses some of its strength with age. Certain medications many seniors take, along with lying down soon after eating, can make this considerably worse. Now here's where things become dangerous if this gets ignored for too long. When LPR goes untreated for years, the constant acid exposure doesn't just cause annoying mucus. It can gradually damage the lining of your throat and esophagus. Research published through gastroenterology associations has linked long-term, untreated reflux to changes in the esophageal lining that require monitoring over time. This is exactly why I never want a patient to simply accept throat mucus as normal. It's not about causing panic. It's about catching something correctable before it becomes something bigger. A third cause, and this one gets overlooked constantly, is simple dehydration combined with dry air. As we age, our sense of thirst becomes less reliable. Many seniors are walking around mildly dehydrated without any awareness of it at all. And when your body doesn't have enough fluid, the mucus that's normally thin and easy to swallow becomes thick and sticky, almost like glue. That thicker mucus is much harder for your body to clear naturally, so it sits in your throat, and you become far more aware of it. Combine that with dry indoor heating in the winter or air conditioning in the summer, and you have a perfect setup for constant throat irritation. A fourth cause worth mentioning is thyroid function. Your thyroid sits right at the front of your neck, and when it isn't working properly, particularly when it's underactive, a condition called hypothyroidism, it can affect mucus production throughout your body, including in your throat and sinuses. This becomes more common as we get older, and it's often missed because the symptoms, fatigue, weight changes, and yes, that throat sensation, get blamed on aging in general, rather than investigated as a thyroid issue. A simple blood test can rule this in or out. Over the years in my practice, I've seen one simple truth again and again. Real, lasting improvement for people over 60 rarely comes from anything extreme or complicated. It comes from finally understanding what's actually happening inside your body and having a clear, simple plan you can follow every single day. That's exactly why I put together the Senior Vitality Blueprint, the complete senior health blueprint. It's a complete step-by-step guide covering 6 areas that matter most for adults over 60. Your heart and circulation, your blood sugar and metabolism, your brain and mental wellness, your bones and joints, your digestion and internal health, including exactly the kind of issue we talked about today, and how to stay strong and independent as you get older. All written in plain language, with one clear action you can take each day. Many of my patients and people who've already gotten the guide have followed this exact plan and started noticing real, meaningful changes. You'll see some of their feedback appear on your screen now, because I want you to hear it directly from them, rather than just from me. Many have shared that they feel more in control of their health, more confident walking into their doctor's appointments, and more at peace knowing they're finally doing the right things for their body. For most of them, it wasn't about doing anything drastic. It was about having one clear, trustworthy plan they could actually stick to. That's what made the difference. I'm not making this available to everyone right now. I'm keeping it limited to a small number of people at this price so I can personally follow up with each person and see how they're doing. If you feel like you've been going back and forth without a clear plan for your health, click the link in the description or scan the QR code on your screen to get your copy before the spots fill up. And because you're part of this community, I've arranged a 70% discount so cost isn't what's standing between you and getting started. Once you have your copy, drop your email and I will personally follow up with you directly. And the fifth cause, which I want to mention because it's often the biggest mistake people make when trying to fix this on their own, involves medications. Several medications commonly prescribed to people over 60, including certain blood pressure medications known as ACE inhibitors, can cause a persistent cough and increased mucus sensation as a side effect. People often don't connect the timing of a new prescription to a symptom that develops weeks later. If your throat mucus started or worsened around the time you began a new medication, that's worth bringing directly to your doctor's attention rather than assuming it's unrelated. If you've made it this far, you're clearly someone who takes their health seriously, and that already puts you ahead of most people watching health videos who just scroll past. If this information is helping you understand what's actually happening in your own body, take a moment right now and subscribe. It genuinely helps me continue bringing this kind of research-backed information to people who need it, and you won't want to miss what else we're covering on this channel about the things doctors wish they had more time to explain in a 10-minute appointment. Now let me tell you about a patient I'll call Raymond because his story illustrates exactly why figuring out the real cause matters so much. Raymond was 68, retired, and had been dealing with constant throat clearing for close to 3 years by the time he came to see me. He'd tried allergy medication on his own from the pharmacy. It helped a little, but never fully resolved things. He assumed it was just something he'd have to live with. When we talked through his daily habits, a few things stood out immediately. He ate dinner late, usually around 8 in the evening, and went to bed within an hour or two afterward. He also mentioned, almost as an afterthought, that his voice felt rough most mornings but cleared up by midday. That pattern was a strong signal pointing toward LPR rather than simple allergies. We made a few specific changes. He moved his dinner earlier, stopped eating within 3 hours of lying down, cut back on coffee and carbonated drinks in the evening, and we started him on a short course of acid-reducing medication under close supervision. Within about 6 weeks, the constant throat clearing had dropped dramatically. By 3 months, he told me it was the first time in years he'd gone entire days without thinking about his throat at all. Raymond didn't need anything drastic. He needed the right explanation and a plan that matched it. So what can you actually do starting today? Let me walk you through the practical steps that matter most. First, pay attention to timing. If your mucus is worst in the morning and improves through the day, that leans toward either postnasal drip from nighttime allergen exposure or reflux from nighttime eating. If it's constant throughout the day regardless of what you eat, that points more toward a sinus or thyroid-related cause. Second, increase your water intake deliberately, not just when you feel thirsty. Aim for consistent sips throughout the day rather than large amounts all at once. Thinner mucus is mucus your body clears far more easily on its own. Third, if you suspect reflux plays a role, stop eating at least 3 hours before lying down, and if possible, elevate the head of your bed slightly. This uses gravity to help keep stomach contents where they belong through the night. Fourth, run a humidifier in your bedroom, especially during dry winter months or if you use central heating or air conditioning frequently. Dry air is one of the simplest, most overlooked contributors to thick throat mucus, and it's one of the easiest to correct. Fifth, and this is the most important step of all, if this has been going on for more than a few weeks, ask your doctor for a thyroid panel and mention every medication you're currently taking, including over-the-counter ones. Don't just describe the mucus. Describe the pattern, the timing, whether your voice changes, and whether certain foods or positions make it worse or better. That level of detail helps your doctor narrow down the real cause far faster than a vague description ever could. Before you go, I want you to think about something. Most people keep waiting for the right moment to finally take their health seriously. In all my years of practice, that perfect moment rarely arrives on its own. What actually changes things is having someone sit down with you and give you a clear, honest plan you can start following today. That is exactly what the Senior Vitality Blueprint was built to do, and if you've been dealing with symptoms like the one we discussed today without ever getting real answers, this is exactly the kind of thing it helps you finally understand and address. Now, I want to hear from you directly. Does your throat mucus feel worse in the morning or throughout the whole day? Tell me in the comments because your answer might help someone else watching this recognize their own pattern. And if this video helped you understand something about your own body today, share it with someone you care about who's been dealing with the same frustrating symptom for years without an answer. That share could be exactly what helps them finally get to the bottom of it. Everything I've shared today is general medical information based on current research and clinical experience. It is not a substitute for personal medical care. Please talk to your own doctor about your specific symptoms, medications, and health history before making any changes. Take care of yourself, and I'll see you in the next one.